is an article that came out in Fatherly, October 25th, 2018. What it's like to tell a man he can't be a father. Ladies and gentlemen, they are saying this is very common today. Very common. And in fact, it is extremely common for both the husband and wife to be infertile. More common than uncommon. When couples cannot get pregnant on their own, it's stressful. But when they continue to fail to conceive, even with help of fertility specialists, it can be devastating. This happens more often than most people think. The expensive emotional process is unsuccessful about 20 to 30% of the time. OBGYN and reproductive endocrinologist Dr. Ralph Zimmerman says most of the time with fertility treatments, people come in with a lot of hope. He told Fatherly, a lot of times physicians do not do an adequate job of counseling them appropriately and helping them come to terms with the fact that they cannot have a child. Zimmerman explains that it's like to tell them what it's like to tell the men who want to be fathers that they are infertile, what their options may be, and that includes a brother to donate sperm, and how couples can cope with male infertility. I would say about 25 to 30% of the time, most of the time, both partners actually have some sort of infertility problems. There are different grades, but the most severe form is when you do not find sperm in the ejaculate, but then you do a testicular biopsy or hormonal study to see whether there are any sperm available. Most of the time, even if you have a very low sperm count, as long as there are a couple of hundred sperm available, those men can probably conceive because they can use a single sperm and put it directly into the egg through a process called intracellular sperm injection. Many times this goes well. Yeah, but you know what? Most people say these fertility treatments are unaffordable to the average person. Most people can't afford it because it costs thousands of dollars to get this kind of stuff done. Based on the criteria from the World Health Organization, what you would like to see close to, that is 15 million per milliliter. And they're talking about sperm. If they have relatively good motility, haven't been trying long, and the couple is in their early 30s, we typically tell them to keep trying on their own. If they have been trying on their own longer or the sperm count is lower, you'd resort to intrauterine insemination, where you would select the best sperm with the best movement ability. And then you would like to see 3.5 to 4.5 million motile sperm. That would be enough for even we did the insemination. If the number of motile sperm is less than 3.5 million, then many times we would suggest IVF. As you inject a single sperm into the egg, there are good fertilization results that way. Passing on a lower sperm count is one of them. There was a paper at the meeting of the European Society of Human Reproduction, and they had looked at younger men who were conceived from men with significant male fertility factors. And the good news was that the young men conceived through this procedure had higher sperm counts and better sperm than their fathers. It's pretty news and a very important result because we as reproductive, okay, so they're talking about as specialists, they're always afraid that it would continue to decline and decline. Um, so you can plainly see that they are looking for ways for couples to have babies through these different fertility treatments, because now it is probably more common among some people that they just can't conceive at all. And like I said, you have a situation where it can be both the men and women. And then they have, let me just go down a little. Then the worst case scenario for men. Is it just no sperm in the ejaculate? There can be a certain location on the Y chromosome, and if this piece is missing, then the ability to produce sperm would not exist. Then, if they wanted to have a child, they have to use some anonymous donor sperm, or sometimes we have to be careful about suggesting this, but if they want to maintain the lineage of the family, sometimes in a few cases, a brother would potentially step into who has a normal sperm count. Then you can maintain the genetic lineage of the family. Oh, wow. Are people disturbed by that option? Oh, absolutely. Whenever you would present such an option, at first it has, so they look at that as incest to some extent. But then you have a couple time to really think about it and process it and know that the sperm will be in a lab and insemination will take place and that there is a consensual agreement, then some people are okay with it. What does this process compare to an anonymous donor? You obviously have to pay a lot of attention to disclosure issues and how the child will relate to the genetic father. All this has to be clarified in detail. So couples going down this road will have to go through a lot of psychological counseling, and there'd be a psychological evaluation of the brother to make sure that everybody really is in agreement. There is also has to be a legal contract too, because sometimes something really unexpected happens, and the key to what you have to do as a reproductive, okay, so they're talking about child protective rights and, okay, so just covering all bases. Wow. I mean, it is deep that people have to go this far to have a baby and they really can't go through the normal process. That's just crazy. And I just can't imagine how much this costs. It really don't have the cost, but I'm sure it's astronomical to even do many of these treatments. Different physicians obviously have different approaches. For me, if somebody has done 2 or 3 IVF cycles and you've gotten like 30 eggs and some nice embryos, then you have to ask yourself, well, what is the issue? Under those circumstances, I would send them to a second physician who would review the records and make sure there's not something everyone has overlooked. And then they would either try one or more, one more time, comes to term with the fact that it may not work and decide to stop. It's a very difficult decision to make. Childlessness is very hard to accept, but once patients are inside the infertility machine, on one hand, we have to help them. On the other, we also have to make sure that they can deal with the loss of control from being able to have children. Wow. I mean, this is crazy what some people have to go through, but this is the times we're in now, ladies and gentlemen. You know, you would think this would be an easy process, but apparently it's not. Please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I will see you on the next video. Peace, family.